Evidence-Based Research, the Basics. Brought to you by Ebling Library for the Health Sciences at the UW-Madison. After you complete this module, you will be familiar with the following. You will understand more about the 5 steps involved in the research process. You will know how to formulate searchable questions for your literature search. You will be aware of the tips for executing effective searches, and we will talk a little bit about evaluating what you find. First, let's look at the big picture of evidence-based practice. Evidence-based practice consists of 3 basic parts: the patient or the population's characteristics and values, the practitioner's knowledge and experience, and the relevant research that you find in the literature. It is this last prong, this last part, that we're going to focus on in this video. Before beginning your research, stop to ask yourself a few questions. The answers to these questions will impact your path and your preparation process. Do you have time and expertise to conduct the research alone? Do you need a partner? Or should you be collaborating with someone? Do you need to consult with a medical librarian on your research approach? Where is the best evidence found on your topic? What type of access do you have to biomedical literature? You may want to consult the Finding Resources video. Which resources should you consult? Do you need background information before going on to specialized resources? What skills will you need to evaluate the literature you find? Are you comfortable evaluating what you find? Do you need a refresher in this area? Let's review the 5 steps of evidence-based practice. First, you define the problem. Then you track down the best evidence. Then you evaluate and appraise the evidence that you find. You integrate the evidence into your practice if it's appropriate. And then you evaluate the process again and look at whether your approach has been effective. And then it is a cyclical process that continues to be evaluated. So you go through the steps again. In this module, we will focus on tracking down the best evidence. So let's look at tracking down the best evidence. What does that involve? First of all, it involves understanding your information need. Then, knowing your information need, from that you formulate a searchable question. Then you identify the appropriate information resources, databases, websites, and other areas that provide quality information. You define your levels of evidence. You look at your results, you see what you need from that pool of information, and you evaluate those results carefully to make sure that what you need is there, or you may have to go to other databases. And then understanding always that this again is a cyclical process. Understanding your information need. First, you articulate your research goal. Is it about patient care? Are you writing a grant? Are you doing some work for publication? What do you need to know before beginning your research? Do you have enough background information on your topic? Research tools, what will they be? What will your preferred databases be? And think about subject headings and related terminology for your core concepts. And always think about how you're going to manage your information as you're going through this process. If you need more background information before you start the research process in earnest, you may want to check some resources such as Medline Plus or some reference texts. You may rely on your expertise and observation. You may want to consult some experts and look at trusted websites. Once you have some comfort with the general topic, then lay out some questions and look at your problem or your scenario. And take that scenario, whether it's patient-based or population-based or problem-based, deconstruct your research topic down to the essential parts, focusing only on the bare necessities. To help you do this, we use what is called the PICO method. That will serve as a guide to crystallize and focus your approach so that you look at only the core elements. PICO is a mnemonic which will make you focus and will bring your attention to those essential parts in your research scenario. Also, think about other things, such as the additional terminology, synonymous phrases, synonymous words that might be beneficial to expand your search, and then run a few test searches to see in the different databases what the outcomes are. Formulating a searchable question with PICO involves the following. The P of the mnemonic stands for either patient or problem or population. The I stands for intervention, the C for comparison, and the O for outcome. Now let's see how this applies to an example here of a 35-year-old woman with recurrent urinary tract infection wanting to know whether cranberries are an effective prevention method. If we look at this and if we apply the PICO method, we see that the P, in this case the patient, is the 35-year-old woman. The cranberries would be the intervention, and the outcome would hopefully be to prevent future UTIs. There is no comparison in this case, which happens. Now let's see what we would do before embarking on our research path in earnest. We would do a little planning here, and we would look at these essential parts, these core elements of our issue, and we would then expand some of these to make sure we're not missing anything. For instance, Urinary tract infection could be UTI, could be bladder infection. Some of these lists can be fairly lengthy, but this gives you an example. The cranberry itself, you could look for cranberry in the singular, cranberry here with the asterisk, which would give it a truncation effect, which would pull in variations of that word with different endings, including the plural. And terms, generic terms that are used for cranberries in different databases. So you can see how, for instance, in this case, PubMed uses the generic term. And expanding your vocabulary will be helpful because different databases will use different terminology. Then identify which resources will be best for your research needs. Note some of these, write them down, and do some exploratory searches to see what you find. Taking a peek inside databases before diving in is a good idea and an effective use of your research time. Adjust your approach and take advantage of the search features found in different databases. This may mean, again, expanding your vocabulary even more, or in some case, limiting it. It really depends on the resource that you're searching. For example, if you're searching in PubMed, it's always good to know the MESH headings, which stands for medical subject headings. Knowing the strengths of the searchable resources will allow you to go where your time is best spent. For instance, you may well choose to do a PubMed search first, since many Cochrane systematic reviews are included there with articles of other levels of evidence as well. Starting in a larger database such as PubMed can sometimes be a challenge, especially if you retrieve large numbers of citations. Knowing the features, the unique features of a database, for instance, how to narrow or filter your search, or how to set limits, or how to apply date restrictions. These all make sense and will get you to your goal much faster. Setting too many limits, however, can be counterproductive and may cause you to miss critical information. So limit judiciously and limit incrementally. Reviewing the levels of evidence at this point or earlier, possibly, is also helpful in screening out unwanted information. Remember, not everything, not every topic has a corresponding systematic review or meta-analysis or even a randomized controlled double-blind study available. You are looking for the best available evidence for your research need. Know how to identify levels of evidence once you find them, sometimes through publication types, as in PubMed or Medline. You can filter by certain levels of evidence. Also understand the limitations of the resource that you are searching. Some searches will be very selective, and if you need an exhaustive search, remember that coverage is very important, and therefore you will want to cast a wider research net, and that means formulating different types of searches. Let's look at an example. Let's do a search simulation. We're going to use the topic of cranberries and urinary tract infections that we had before. This is a very uncomplicated scenario, and obviously most of the time patient scenarios will be much more complicated, but for the sake of demonstration we will keep this simple. If you look at this and ask yourself, what is the searchable question in this scenario? And as we had before, here is the example when we apply the PICO method. We basically deconstruct our scenario to show the basic concepts, the basic elements which will be used in our search process. Then we need to assess whether we need more information before going on about our topic. Do we need background information? And that we can obtain in a number of resources, Medline Plus, good reference books, texts, online reference texts, and so on. Even from quality websites out there available at professional organization sites. Or do we need much more specific information, which we will get in applying something like PICO? Once you have your PICO elements defined and your terminology in place, expanded, it is time to do some searching. So let's pretend that we entered our search strategy here. We will use PubMed as an example. And remember that prior to this, we thought about our research goal, in this case, to find out whether cranberries are effective in preventing UTIs. We've sketched out our PICO statement with the corresponding terminology. We've looked in PubMed to see if there is a subject heading, a medical subject heading we can use. And we entered our search in the entry field. And you can see here an example of the results that we found. Remember to use the special features, the special search features of the database that you are using to refine your search. Here is an example of what you might want to do in PubMed. You may want to limit by systematic reviews, and that's a whole set of publication types that will retrieve, or you may specifically want to call out the meta-analyses or review articles. You can limit by a number of criteria, as you see here, and this is only a small sample. But let's look closely, a little more closely, at some of the details of the records that we have found through this search. Here is an example of a Cochrane systematic review retrieved through PubMed. Notice the subject terms can be viewed as well here in the little box. And that will show you, that will represent some of the entry vocabulary for our search. Subject terms can only be viewed by displaying one type of record format, which is called the citation display. In PubMed, there are different modes of display, some brief, some longer. This is the longest display, which gives you the benefit of seeing your subject headings and seeing your publication types as well. So you know that this is a meta-analysis or a systematic review. Using subject headings alone to construct searches in PubMed is short-sighted, however, because what you do is miss the most current articles that have no subject headings appended yet. If we look at our systematic review a bit closer, we see that we can actually use the table of contents to review the sections of the review itself. Full texts of systematic reviews are generally not available without a subscription, and that means cost. Let's look a little more closely at some of the information that is included here. For instance, the main results of the review itself, the author's conclusions, and then what is often very handy if you can find it in a systematic review is the plain language summary. Again, if these are not available to you in full text, interlibrary loan is certainly an option. Here is an example of a review article. Sometimes review articles and systematic reviews are confused as publication types. They are not the same. A systematic review, which we just saw an example of, while still considered an article, they're both article types, a systematic review is based on very precise evaluation criteria and is usually quite detailed. It is also quite lengthy and is very exhaustive in its coverage. A review article, which you see here, also looks at a specific topic and analyzes that topic, and it provides a survey of sorts of some of the existing literature in that specific area. Review articles are often very good background sources to become familiar with an unfamiliar topic and to see what the latest literature is in a certain field. We also found some practice guidelines. This is an example of one. Remember that professional organizations also issue practice guidelines and list these on their websites. So while PubMed is one way to find these, there are other points of access as well. And here, from the same search, you will see a clinical trial. And clinical trials, there are many levels of them in size and in rigor, and they appear at different points on the evidence pyramid. For instance, if a clinical trial is larger or is blinded, it will carry more weight. And of course, you have the opinion pieces. The letters, while very valuable in their own right, again, great place for new information or background information that you may want to follow up elsewhere. Now that we've found some articles at different levels of evidence, we need to think about how to appraise what we have found. What are the best studies? What is the highest level of evidence that you've found, and does it apply? Are the sources credible? And are they applicable to your particular research point or situation? Next, let's look at each article and then the level of evidence represented to assess its, not only its applicability, but also the quality of the study, the validity, the size, and questions that you ask of articles that you find or documents that you find will vary according to the research methodology used in that particular document. Appraising the evidence. Evaluation and appraisal are critical components of the research process, really at every point, but now we're talking about looking at the results that we find. Not all research is equal. You have to scrutinize your results carefully, and do not rely on abstracts alone. Read the entire article before including it in your own research. With data and statistics, make sure that you know how they were gathered and assessed. For additional information, see the reading list that is attached in the handout. And don't hesitate to contact Ebeling Library with your questions or your requests for document delivery, research assistance, and training needs. Thank you.